Okay, I will be talking about the HIV pandemic and be focusing on 2005 and 2012. So what is HIV? I'm sure everyone has heard of HIV in their previous bio courses, however, I'm going to just be generalizing on it. So HIV attacks the CD4 cells, which is also called the T helper cell, and these are a special type of white blood cell that basically fights off infection and other foreign things that is done inside our bodies. What makes HIV unique is that it is an RNA virus, as it incorporates RNA into our DNA by the use of its enzyme called reverse transcriptase. And once RNA is in our DNA, this enzyme converts it back to DNA, so it tricks our own DNA to making more proteins of HIV. However, even with all that, it's still a relatively weak virus compared to the cold virus, as its survival rate outside the mucous membrane is about a few minutes to a couple hours. And I'm going to be talking about the symptoms in just a sec. So how do you get HIV? You can get it through blood, semen, amniotic fluid, and breast milk. And the last two also means that unborn babies in pregnant women can also be passed on. The use of sharing needles between drug users, and also the most famous one, which is unprotected sexual intercourse. Most people who have symptoms of HIV often experience it in the acute stage, which is the early stages of HIV, and they're very, very flu-like, which is categorized by fever, runny nose, cough, shortness of breath, swollen lymph nodes, etc. However, in recent years, it was known that HIV had a distinct rash that was characterized by splotty red blotches all over the body. But even with these symptoms alone, it is difficult to distinguish HIV as a diagnosis. So by the end of 2005, an estimated 40 million people worldwide were living with HIV infection or disease, which was also a notable rise from the 35 million infected with HIV in 2001. That means testing became very, very prevalent and important in this year, as well as antiretroviral therapy. I'm going to just use ART for this presentation. So in this graph, as you can see, the number of people who died from AIDS was very, very high, and the number of people who are on ART were very low in 1996 to 2005 because there was no knowledge about the treatment for HIV. But as you can see, as the years progressed and ART became more well known to the community, as that rose, the rate of AIDS progression died down. In 2012, FDA finally introduced to the community a drug called PrEP, which stands for pre-exposure prophylaxis. And this is proven to be effective, or greater than 90% effective in protecting against HIV, but does not protect against other STIs, like bacterial ones. And the way it does this is that it basically prevents HIV from replicating within the body by creating like a barrier around the CD4 receptors of the cell. And just a fun fact, people who live with HIV but are not on PrEP but are on the HIV medications, they get their viral load to have an undetectable count, which means you cannot pass it on. So basically, if you have sexual intercourse with someone who was HIV positive, but they were on HIV medication and they were undetectable, that's very important, you still can't pass it on. And Truvada, like the background picture, that is the most common PrEP that is prescribed to people. However, back in 2019, there was a recent lawsuit that had issues with Truvada decreasing bone density. There's also one more drug called PEP, which is post-exposure prophylaxis, and that can only be used within the 72 hours of being in contact with someone who had HIV. Also, this medication is very, very expensive, so you must get insurance because it's about $1,200 per prescription. All right, and then the one thing I wanted to talk about was also Descovy, which actually is the one I'm on, but Descovy is a newly released PrEP, and the FDA just approved this back in, I believe, the end of 2019. This one is still costs the same price, however, it has less side effects, and I think this was a stepping stone for the LGBT community because Truvada was the only option for PrEP, but now PrEP there's two options now. So I think it's cool that it's becoming more of a well-known factor that people are trying to protect themselves. There was a study done in the Midwest, and specifically in the Midwest by Owens, And the sample size was too small, but there is a reason why. And that is because there was a social stigma within the Midwest with the LGBTQIA community. As maybe most of you know, the Midwest is very conservative, and gay people were not very recognized, even now to this day. So basically, in the study, people who were on PrEP or were thinking about PrEP and who had HIV services that were offered were interviewed, and it was just basically getting their opinions and reactions to the services and treatments they were on. The age group was 18 and over, and the overall results of these interviews was that it proved that there was a lack of PrEP infrastructures in hospitals and the community overall. There were actually also negative reactions of the doctors themselves or the primary care physicians due to that social stigma that surrounded PrEP and the LGBTQ community. And this ultimately led to the result of just overall in the community that there was just a lack of PrEP education overall. And even not even just the Midwest, it is in LA too. PrEP is just starting to become more well known. And that is all for my presentation. Oh, but for one last thing about this, I chose this study as my presentation because it proved that, even though in LA the LGBTQ community is becoming widely more recognized, it also proved that the Midwest is kind of finally opening their doors. So that's just one point I just want to make out. Okay, thank you.